So now I'm going to ask Dan. He's a new adopter of these lenses. He was monofocal user and a young doctor in the regional. Now, there's some people in our chair who are thinking of going to a multifocal, and obviously your EDOF. What's your experience up to date?
So my experience was that the first advice I'd give to anyone who's young and starting on this journey and wants to pursue premium lenses in the form of EDOFs and trifocal lenses is find yourself someone senior like Brian and try and pick his brain. So my journey with the trifocal platform Liberty started about 12 months ago when I attended a dinner and had the opportunity to speak to Dr. Harrisberg and sort of learn what the criteria was for patient selection. I was a little bit sceptical because most of my practice is in a regional centre in Australia and most of the patients do long distance driving, and I wanted to avoid things like glare, halos, starbursts and all the other things that we hear about. As registrars, we really don't get much exposure to trifocal lenses or the technology that's actually available and out there, but as patients were coming through, they did express a certain dissatisfaction with the fact that after cataract surgery, they were still reliant on their glasses, and a lot of the time it was simply because I realised I hadn't been offering patients more options aside from monofocal. I was quite afraid that I'd have to do lens exchange, they wouldn't be happy, and they'd be too symptomatic to actually get a benefit from these lenses. So after getting some advice from Dr. Harrisberg, I started my journey, and I started with about 10 patients initially. And my patient selection was very, very careful. I was careful to ensure they had a perfectly pristine cornea. They couldn't have had previous refractive surgery, of course. They had to have a healthy macula and a healthy optic nerve. And most importantly, they had to have very reasonable expectations. I think that was really the key. It is, of course, possible to try and determine how much glare and things people already have just by asking them, but even slit lamp examination, if they're unable to tolerate a simple slit lamp examination from glare, they may not be an ideal candidate for this lens. So after my first 5 patients, which were very carefully vetted and selected, and of course I was using quite a bit of help from the team at SurgiVision to pick the lenses appropriately to ensure I was getting good refractive outcomes, I found that everyone was very happy. And pretty much within 2 months, people basically said they didn't have any glare or halos or anything else. I was very careful to counsel patients on not driving too early in these regional settings where they might be driving 200 kilometres in northwest New South Wales. And sure enough, I found that they were driving in 2 days. And when I asked them about their symptoms, they really didn't say they had any. So the interesting thing about this was that the refractive predictability was very stable with good calculations. I think corneal topography is a must, and good quality IOL measurements and biometry. So if I had to, sometimes I'd pre-treat these patients with lots and lots of preservative-free lubricants as well as some steroids if they had underlying dry eye disease, and often repeated their measurements a number of times. So my journey started like that, and it's only sort of come along as I've gained more confidence in the technology and using it. So I think the biggest advice for anyone young who'd like to start on this is find yourself someone more experienced and ask them for help.